Weight loss surgery can mean a whole new you, but how do you keep the weight off? Dr. Mike Tyner from the Bariatric Specialist of North Carolina is here to explain what makes a patient successful after bariatric surgery. And you suggest patients need to become food scientists. What does that mean?
Well, the important part of all this is understanding how you feed your engine. What do you put in there? And before surgery, a lot of patients aren't aware of the things that they take in, so we really want to stress that. So how much protein are you getting in? How much carbs are you getting in? And how's your body using those calories that you're getting?
You really need to read labels, don't you?
We really stress, turn the can around and look at the back.
Okay, how important is it to stay physically active after bariatric surgery?
Well, exercise improves your heart function, your muscle function, but that metabolism helps take care of the calories that you're taking in. And most people feel better after they start exercising.
And support's also really important, isn't it?
It's a big part of this. After surgery, the patient's taking on a new world. And hopefully food is not the center of that world. So we need to have a situation where the patient understands what their stresses are and understand new ways to deal with stress. And that involves having a support group that includes, the doctors, and I tell patients, with this knife IV wed, and what that means is you have to come back and see us, and we're going to encourage the patient. In addition to that, we have a nutritionist who is there to help guide the patient with this food science idea and make sure they're getting the right thing. And in addition to that, we have a support group, which is made of bariatric patients. They gather once a month and talk about the things they're going through. And unfortunately, if a patient goes home, their friends may not be able to relate to that at all because their friends used to gather around eating, and hopefully, again, that's not the focus of things. So in addition to that, what we find when patients lose weight, their friends don't really know what to do with them because it's not the weight thing, and there's some jealousy that comes involved.
Right.
Another thing we find is that family doesn't always work because sometimes spouses get jealous because the patients are changing, and it's like, who's looking at you?
Yeah.
In addition to that, patients don't always know what to do because now other people are paying attention to them because they're thinner. And how do they relate to the rest of the world? So patients need support, and the support group can do that. We encourage folks to see psychologists or psychiatrists. Stay in touch with them because their world is changing, but their stress management may not have changed with it.
And this is something that patients can get from bariatric specialists. You all put them in a position to be successful.
We start before surgery as part of the initiation of the process to get to know a psychiatrist or psychologist to understand to some extent what their stress management might be. And after surgery, we steer folks to the support group meetings. We encourage them to come back and see us. In addition to that, we actually steer people to a lot of social media sites where there's a lot of patients talking about things like this.
Well, this is great information. Thanks so much for sharing it.
Sure.
You can reach Bariatric Specialist of North Carolina at 919-234-4468 and surgerync.com.